Premier Scott Moe is not budging. Despite the dire ICU situation, Moe says additional public health measures are not fair.
That large proportion of people that are vaccinated is why we have resisted calls from many to impose more widespread restrictions, to impose potentially lockdowns and ultimately business closures, because we don't think it's fair.
For weeks, doctors have been pleading with Moe to impose more measures, such as gathering limits.
Unless we put those restrictions in place, this is just going to keep dragging on and on and on and get progressively worse.
But Moe says it doesn't make sense to restrict everyone's activities and that it would ultimately impede their personal freedoms. Opposition leader Ryan Miley reacted strongly.
That was a slap in the face. A slap in the face to Dr. Shahab, whose recommendations are being ignored, a slap in the face to the healthcare workers.
71 people are critically ill from COVID in ICUs right now. The military has stepped in to help. 6 critical care nursing officers are expected to arrive to intensive care units Wednesday.
Add to the 480 that we have operating here now, it isn't going to make, I would say, a significant difference. But I think at this juncture, every difference matters, and so we're very appreciative of the federal government's 6 critical care nurses.
Moe says another 60 to 70 nurses in Saskatchewan are upgrading their training to work in ICUs and should be available in the days and weeks ahead. Another way to relieve pressure on our overburdened hospitals, transferring patients to Ontario. 3 more patients are being airlifted today. An internal memo from the Ontario Critical Care COVID Command Centre says by the end of Wednesday, if all goes as planned, 19 Saskatchewan COVID patients in ICU will have been transferred to Ontario. Yasmin Ranea, CBC News, Saskatoon.